I didn't react very well because if I would have known earlier that I had Alpha-1, I could have perhaps been on the prolactin much earlier and maybe had saved more of my lung function, which right now it's only at 27%, so it's not very good. My body doesn't make its own Alpha-1 antitrypsin. So what happens is eventually my lung function regresses, and over the years will just get worse and worse and worse. I realize that it is a genetic disease, and I had both of my adult children tested, and they have both tested positive. And I also had my brother and sister go, and my sister has also tested positive for the Alpha-1 gene. It's helped me emotionally 100% getting this prolactin treatment, just knowing that since I've started it, my lung function has stayed the same. It has not, it hasn't declined. If you don't have it, then what happens then? Then my lungs get so bad where I do have to go, and I'm waiting for a lung transplant. It's not that easy to just say, yeah, lung transplant's gonna totally help me, but what's the cost involved in that compared to having early detection and getting on that prolactin, and maybe not even having to worry about getting the lung transplant later because you've caught it early enough that you're keeping your lungs in lung function up. If my treatment were to stop, my biggest fear, of course, is the lung function declining, and eventually to the point where my lungs just won't work anymore. And my biggest fear is my kids and my grandkids losing me. My anxiety has gone through the roof, and I'm dealing with depression basically because I don't know what my next move is. As of April 20th, I don't know what's going to happen to me, so I don't even know what my future looks like right now. Ministers of Health, I would like to ask you what you would do if one of your children or one of your parents were going through the situation where you won't cover a drug that, yes, it is expensive, it's also saving lives. And I would just really like you to just rethink what you're doing to people and their families, not just the people themselves, but their families.